Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back to Policy and Rights here on Depictions Media. I'm your host, Michael, and as we're moving forward, today is February 10th, 2021. South Africa has halted their vaccination program due to the fact that they believe they need to do more studying and more testing of the AstraZeneca vaccine before distributing to help immunize people against COVID-19. Of course, South Africa is one of the ones that has one of the stronger variants of COVID-19, and they just believe that they need to do more study to make sure that they're using it effectively and that the vaccine itself will be effective to help the people of South Africa. So let's listen to what Dr. Tedros and Professor Karima of South Africa actually have to say.
Hello, everyone. I am Fadila Sheikh speaking to you from WHO headquarters in Geneva and welcoming you to our global COVID-19 press conference today, Monday, 8 February. I would like to start this press conference by sending my apologies for the delay in starting this press conference. Sorry for that. We will have three special guests today that Dr. Tedros will introduce shortly. We have simultaneous interpretation in the 6 UN official languages, plus Portuguese and Hindi. Let me introduce to you the WHO participants. Present in the room are WHO Director General, Dr. Tedros, Dr. Mike Ryan, Executive Director, Health Emergencies Program, Dr. Maria von Kerkhove, Technical Lead for COVID-19, Dr. Mariangela Shimau, Assistant Director General, Access to Medicines and Health Products, Dr. Soumya Swaminathan, Chief Scientist, Dr. Bruce Aylward, Special Advisor to Director General and Lead on ACT Accelerator, Dr. Kate O'Brien, Director Immunization, Vaccines and Biologicals. Welcome all. Now, without further ado, I will hand over to Dr. Tedros for his opening remarks and introduce our three guests. Over to you, Dr. Tedros.
Thank you, Fadila. First of all, I would like to apologize. Sorry for keeping you waiting. We had a meeting that took longer than we expected, many of my colleagues here and myself. So apologies for that. Good morning, good afternoon, and good evening. Yesterday, a new case of Ebola was reported near the city of Butembo in the Democratic Republic of the Congo. Butembo is the North Kivu province. It is in the North Kivu province, where a previous outbreak was declared over in June last year. The woman who sadly has died was married to an Ebola survivor. Thanks to the enormous capacity built during the latest outbreak, provincial health authorities have significant experience in responding to Ebola and in preventing onward transmission. More than 70 contacts have been identified, and WHO is supporting local and national authorities to trace them and provide care where needed. So far, no other cases have been identified, but it's possible there will be further cases because the woman had contact with many people after she became symptomatic. Vaccines are being sent to the area, and we hope that vaccination will start as soon as possible. WHO has sent a rapid response team to provide support as needed. The Oxford-AstraZeneca vaccine is one of several that has been shown to be effective in preventing severe disease, hospitalization, and death from COVID-19. The emergence of new variants of the virus has raised questions about the potential impact of those variants on vaccines. Yesterday, South Africa announced that it was putting a temporary hold on the rollout of the Oxford-AstraZeneca vaccine after a study showed it was minimally effective at preventing mild to moderate disease caused by a variant first identified in South Africa. This is clearly concerning news. However, there are some important caveats. Given the limited sample size of the trial and the younger, healthier profile of the participants, it's important to determine whether or not the vaccine remains effective in preventing more severe illness. These results are a reminder that we need to do everything we can to reduce circulation of the virus with proven public health measures. Several countries are succeeding in suppressing transmission, including those where new variants are circulating. We all have a role to play in protecting vaccines. Every time you decide to stay at home, to avoid crowds, to wear a mask or to clean your hands, you're denying the virus the opportunity to spread and the opportunity to change in ways that could make vaccines less effective. It also seems increasingly clear that manufacturers will have to adjust to the evolution of the virus, taking into account the latest variants for future shots, including boosters. We know viruses mutate, and we know we have to be ready to adapt vaccines so they remain effective. This is what happens with flu vaccines, which are updated twice a year to match the dominant strains. WHO has an existing mechanism for tracking and evaluating variants of the virus that causes COVID-19. It's vital that countries continue to report these variants to WHO so we can coordinate global efforts to monitor their impact and advise countries accordingly. We are now expanding that mechanism to provide guidance to manufacturers and countries on changes that may be needed for vaccines. These developments highlight why it's so important to scale up manufacturing and roll out vaccines as quickly as possible and as widely as possible to protect people before they're exposed to new variants. We also need to continue designing and conducting new trials, and we need to keep a close eye on the impact vaccines are having on epidemiology, severe disease, and death, so we can use vaccines to maximum effect. WHO Strategic Advisory Group of Experts on Immunization, or SAGE, has met today to review the Oxford-AstraZeneca vaccine and to discuss these new developments. Tomorrow, I will meet with the chair of the SAGE to discuss its recommendations. To say more about the new study in South Africa and its implications, I'm pleased to welcome Professor Salim Abdul Karim, the co-chair of South Africa's Ministerial Advisory Committee on COVID-19. Professor Abdul Karim, thank you for joining us today, and you have the floor.
Thank you very much, Dr. Tedros. It's indeed a pleasure and an honor to be here with you. I'll just briefly share with you the reasons behind the South African decision and how we are viewing the situation. So put very simply, we have been monitoring how the different vaccines are stacking up in terms of their laboratory assays, whether they're tested in a pseudovirion assay or in a live virus plaque assay. To date, 5 of the 8 vaccines that we've been monitoring have had these laboratory assays. What they show is that vaccine-induced antibodies have greater difficulty neutralizing the 501Y V2 variant than they have against pre-existing variants. We saw substantial declines in some vaccines and less so in others. So, for example, with Pfizer and the Sinopharm vaccines, we saw minimal reduction in the potency of the antibodies and minimum changes in neutralization activity. However, with other vaccines, such as the AstraZeneca vaccine, we saw very substantial reductions in neutralizing activity. We don't fully understand what those laboratory results mean, so we need clinical data. Fortunately, 3 of the vaccines have been tested in South Africa, where the 501YV2 variant constitutes about 80 to 90% of the circulating viruses. The first results that we heard were from a vaccine produced by Novavax. And there we heard, quite concerningly, that the efficacy of the vaccine was 89% in the UK, but only 49% in South Africa. That was the first indication that efficacy levels would be diminished in addressing the 501YV2 variant. Most recently, we saw this week the release of a study. It's quite a small study with 2,026 participants, largely young individuals. And one of the important things is that the trial used a dosing interval that is quite short compared to the newer, longer intervals that are being proposed by AstraZeneca. So looking at that, what was shown that while the overall efficacy of the AstraZeneca vaccine was 66% in the largest study that included the UK, Brazil, and South Africa, the South African data on its own showed only 22% efficacy. It should be noted it has a very wide confidence interval that includes even 60% protection in that confidence interval. But that study, which looked at only mild and moderate infections, raised concerns. Not because that we were not expecting some diminishing activity, but it was the level to which it was diminished. And so now we are unclear and uncertain about the efficacy of the vaccine in preventing hospitalization and severe disease. We know from the overall trial that the AstraZeneca vaccine is effective against other pre-existing variants. We're just not confident about its efficacy against the 501YV2 variant. And so we've proposed an alternative approach, a new approach to the way in which to roll out the vaccine. And one proposal that's currently being considered is to roll it out initially just in a stepped manner, where the first step includes about 100,000 individuals that are vaccinated, in which we monitor the hospitalization rates. If they are below the threshold that we are looking for, then we're confident that the vaccine is effective, again, in preventing hospitalization, and then we can roll it out. Alternatively, if it's above that threshold, then we'll need to look at alternatives. So put very simply, we don't want to end up with a situation where we've vaccinated 1 million people or 2 million people with a vaccine that may not be effective in preventing hospitalization and severe disease. We think that in order to do so, we have a more prudent way in which we can do that, which is to make an assessment and then roll it out on a grander scheme. So all that has been suggested at this point is to delay the rollout of the AstraZeneca vaccine until we have the processes in place to undertake this kind of stepwise implementation approach. On that note, Dr. Tedros, thank you very much.
It is important that that everything that we do during this pandemic is actually studied, documented, and questioned. And that is exactly what Professor Krim is doing in South Africa to ensure that the safety of the people there. So moving on, we're going to go to British Columbia, and we're going to hear from Dr. Bonnie Henry, health official in British Columbia. And as we know that they have put in place new rules and restrictions in schools to try to help curb the community from acquiring more cases and try to keep the pandemic curve down in British Columbia. The restrictions are not met without some opinions from the BCTF and the teachers in the area. They want to be clear. They want it to be very black and white, and some of the rules don't seem to be that. And there's some areas where they think that with some of the classrooms being tighter and having little ventilation because they're portable trailers, that there should be even tougher restrictions and more things held back. But let's listen to what Bonnie Henry has to say, because they also have in Canada, there is a big weekend coming up for Family Day, and people want to gather. It is Family Day. People are going to want to gather, and let's listen to what Dr. Bonnie Henry has to say about joining up with family, traveling to see family, and that sort of thing.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, February the 8th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. The next 3 days, Tuesday, Wednesday, and Thursday, we'll be providing written reports at 3 o'clock with the latest information about the COVID-19 pandemic in BC. And then on Friday, we'll be providing an in-person briefing at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So today, being Monday, we're reporting for 3 reporting periods. And I do think I have the dates right this week. Starting February 5th to 6th, Friday to Saturday, we had 428 new cases diagnosed with COVID-19 in BC. February 6th to 7th, an additional 465 new cases were diagnosed, and in the last 24 hours, 343 additional cases, bringing the total number of new cases over the weekend to 1,236, 5 of whom which were epidemiologically linked cases. And that brings our total in British Columbia to 70,952 people who've been diagnosed with COVID-19. Of the new cases, 266 were people in the Vancouver Coastal Health Region, 601 in the Fraser Health Region, 86 people were on Vancouver Island, 152 people in the Interior Health Region, and 131 people in the Northern Health Region. Today we have 3,976 active cases in all areas of British Columbia, and of whom 234 people are in hospital, 69 of whom are in critical care or ICU. And we have approximately 6,900 people under active public health monitoring, and 605 people are now recovered. Again, over this weekend, we've had 13 new deaths from COVID-19, bringing the total number of people who have died from this virus in our province to 1,259. Our condolences go out to those families and caregivers and communities who have lost loved ones again this weekend. We have 2 new healthcare outbreaks, both in acute care hospitals, one at the Abbotsford Regional Hospital and the other at Dawson Creek District Hospital. And 4 outbreaks have been declared over at Evergreen Baptist Care Centre, the Hilltop House, Mount St. Joseph Hospital, and the Nanaimo Regional General Hospital outbreaks. That leaves us with 22 active outbreaks in long-term care assisted living and 9 in acute care, involving 708 residents in now. This program 154,496 have those 1,111 have received. Each week this month, our available supply wins, and we are looking forward to early in March when we anticipate being able to fully start our mass vaccination clinics around the province. And we are planning for that and for the rollout of this phase now. For those people who are in that group that we are going to be getting to as soon as we can, people who are over age 80 in our community, in the coming days and weeks, you will receive the information you need to know where your clinic will be or how you will receive vaccine. We're working on the details in every community across the province, and they will become clear in the next little while. And there'll be multiple ways that we'll be contacting people. Just to update you on adverse events, we've had 217 reports of adverse events following immunization since the start of the program. 18 of those were anaphylaxis or severe allergic reactions, and we continue to closely monitor and track for these events, as our national and international partners do as well. And we're watching what is happening around the world so that we can be reassured of the safety of the vaccines here in British Columbia. As well, as we talked about last week, we are watching very closely for the further spread of what we call variants of concern here in British Columbia. We're now, to date, have 40 confirmed cases of the here in BC, and that's 25 confirmed cases of the B117 variant that was originally found in the UK. Of those cases, 15 are in the Fraser Health Region, 5 are in the Vancouver Coastal Health Region, 4 are here on the Island Health Region, and 1 is a person who resides in the Interior Health Region. All of the cases, most of the cases of this variant are related to either directly related to travel or contact with somebody who's traveled. We have 1 case that we have not yet found a connection. We additionally are up to 15 people now who've been confirmed to have the B1351 variant, which was initially identified in South Africa. 13 of these 15 cases are in the Vancouver Coastal Health Region and 2 in the Fraser Health Region. And concerning for us, and we're still investigating, is how particularly 4 people from that group of 15 where we are unclear where they have contracted the virus and the variant. Of the 40 confirmed cases, though, I will say we only have 3 that are currently active, and Public Health has done extensive follow-up and tracing back of all of our cases, and the ones we know about, we are confident for the majority of them that there has been no onward transmission. Every day that we stop spread of this virus, no matter what the variant, we buy ourselves time. Time to get our immunization program up and running again, as we're going to be this week, and also time to better understand where we are seeing transmission and cases of this variant virus, these variants of concern in our communities. We are also closely monitoring our progress in this COVID-19 pandemic, and our intent is to ease the restrictions that we have in place as soon as it is safe to do so. We want to have that confidence that as we open up more, as we have more social connections, we do not have to step back again. I'm monitoring for a number of things. Fewer cases in our communities, fewer outbreaks or unchecked transmission in places around the province. These are important signs that we are ready. Also, having a better understanding of where the variants of concern are and how they're getting into our community. We are on track, and that is why it is so important for all of us to continue doing what we're doing and not throw away the progress that we have made. Our focus right now is to clear our path of those hurdles so that we can ease the restrictions as soon as possible. I will say this past weekend, WorkSafe BC and our public health environmental health teams were out again conducting spot checks and monitoring to make sure that we can support people in all places to follow COVID safety plans and keep everyone safe. And I do want to say thank you to everyone who stayed home with their families and watched the Super Bowl, or went out with their close group to the restaurant sector. And I want to say thank you to that sector, to our restaurants, our food and beverage sector, and the people who were there this weekend for doing your part this weekend to help us continue to flatten our curve and support people to watch the game in a safe way. As we have seen, the choices we make today, as well as the plans we make for tomorrow, make a difference. And just as you did this past weekend, I'm asking everyone to do the same with our upcoming Family Day weekend. We all need to stay local and not travel unless it is required for work or medical reasons. I understand and know the many sacrifices that people continue to make, and I know that limiting travel impacts our tourism sector across the province. So I'm calling on everyone to support our local tourism sector. Be a tourist in your hometown, in your community this weekend. Book a night at your local hotel with your family. Order dinner from a favorite restaurant. Do takeaway. Or go outside and explore. Being outside with those that we are close to, with those we care for, is safer than being inside. So this weekend, connect and go for a walk with somebody that you're close with, or go sit outside and have a talk. By avoiding travel now, we'll have much more to enjoy and many more places to visit in the weeks ahead once we get this pandemic under control. So let's continue to push our curve down by staying small, staying local, and using all of the things that we know protect us, no matter what the variant we're dealing with. And that means cleaning our hands regularly, staying home when we're ill, making sure that we get tested if we have any concerns about having the virus, making sure we keep our safe distances, whether outside or inside, and of course wearing masks when we're in those common public areas. These efforts will make sure that once we have the protections we need, we'll be able to see our friends again. We'll be able to hug our grandparents and enjoy all that is spectacular in our province. We have the confidence knowing that it won't put our friends and family and loved ones at risk. We know that this virus transmits to those we are closest to. So let's do our part now to keep us all safe so that we can start to ease these restrictions as soon as possible. And of course, let's always remember to be kind, to be calm, and to be safe. Thank you.
All right. Traveling during the pandemic may not be the best of ideas, but there are always other ways that we can connect with family, with telephones, the internet, and the vast number of tools that we have available to us to communicate via camera links and so forth. So please do use those, seek those out. Look for Zoom. There's a Meet Fox tool and other things out there too that we can find to help us connect with loved ones who are at a greater distance than we should travel. Okay, so since we're talking about travel, there have been imposed new restrictions for non-essential travel across land borders into Canada, and the restriction is as follows, where if you come into Canada via land and you need to quarantine, and you will be directed to a hotel to be quarantined in, you will be submitted to a PCR test, and you will be held in the quarantine for at least 2 weeks, or should I say a maximum of 2 weeks, or until you have a negative PCR test. And then from there, you will spend out the rest of the 14-day quarantine in your home. So the cost of all this will be exactly $2,000 according to all the government documents, and the hotel is certified by the government that you will be staying at, and of course they will be administering the PCR test. So let's listen to what Justin Trudeau, the Prime Minister of Canada, actually has to say about those restrictions, and he will also be talking about CERB and taxes, so that we can fully understand what we're going to be looking at now that tax time is coming up on us.
Good morning, everyone. Bonjour tout le monde. It's been just over a year since the first major flight we organized to bring Canadians home from overseas. When we were coordinating emergency repatriations last winter, our priority was doing whatever it took to keep people safe. And from that moment right through to today, that continues to be what we're focused on. From border measures to vaccines to rapid testing to the wage subsidy, we're using every tool in the toolbox to get us all through this crisis. Let me start with some news on border measures. As of February 15th, when you return to Canada through a land border, you'll need to show a 72-hour PCR test, just like for air travel. Dès lundi prochain, le 15 février, lorsque vous revenez au Canada par les frontières terrestres, vous devrez fournir un résultat de test négatif remontant à un maximum de 72 heures, comme pour le retour par avion pour les voyageurs non essentiels. Today, I also have some news to share on vaccines. This week, tens of thousands of Pfizer vaccine doses will be delivered to Canada. This is good news for so many people who will be getting their dose. We know we all want to feel that relief of getting vaccinated, of watching our loved ones get vaccinated. We're all eager to know when it's going to be our turn. Well, I can tell you we are still very much on track for tens of millions of doses into the spring, and for everyone who wants to be vaccinated by September. Moving forward in the coming weeks and months, we're going to get even more doses, even faster, so we can all move through this together. Next week marks the start of a major ramp-up in vaccine shipments. Starting on the 15th, we're expecting hundreds of thousands more doses each week, and that's just from Pfizer. There are also other vaccine candidates currently in the approval process, and the top experts at Health Canada are working around the clock to ensure that any of these new vaccines approved is both safe and effective. On a déjà administré plus d'1 million de doses de vaccins contre la COVID-19 au Canada. Ces doses vitales ont été administrées à vos parents dans un établissement de soins de longue durée, à votre amie qui est infirmière ou à votre voisin qui est préposé au service de soutien à la personne. Et c'est seulement un début. On va poursuivre ces efforts jusqu'à ce que tous les Canadiens qui le souhaitent puissent se faire vacciner. Cette semaine, ce sont des dizaines de milliers de doses supplémentaires de Pfizer qui arrivent et plusieurs autres millions s'en viennent. En ce qui concerne les vaccins, les choses se déroulent comme prévu, malgré des délais temporaires. On va recevoir 20 millions de doses de Pfizer et de Moderna au cours du printemps. D'autres candidats vaccins sont en cours d'approbation. Les experts de Santé Canada travaillent très fort et vous pouvez être certain que tout vaccin approuvé sera sûr et sécuritaire. Je le confirme, vous et votre famille pourrez vous faire vacciner d'ici septembre. Mais même si tout se déroule comme prévu quant aux vaccins qui seront livrés aux Canadiens, on n'est pas encore sorti du bois. En gardant vos distances, en vous lavant les mains et en portant le masque, vous continuez à contribuer aux efforts contre la COVID-19. Il ne faut surtout pas lâcher. This morning, I also want to talk about where we are with testing. Rapid testing is key to to keeping this virus under control, especially in schools, long-term care homes, and workplaces. Last Friday, this is something I spoke about with Dr. Janine McCready in Toronto. She and her team have spearheaded an innovative testing program at several schools, getting tests directly to communities that need it. In some neighborhoods, she told me that as many as 1 in 5 tests, that's 20%, come back positive. Clearly, there's real need for this testing. Her work shows that when people can get screened for COVID-19 and then get their results quickly, we can stop the spread. And this is true right across the country. Here in Ottawa, a recent program to test asymptomatic students and their families found several positive cases. Since they weren't showing any symptoms, without testing, these kids would have been in a busy classroom. But because of ramped up testing, their families knew to isolate at home instead. Testing widely and often reduces transmission. That keeps cases down and it keeps people safe. Our government has sent 19.6 million rapid tests to the provinces and territories, with more on the way. We all want to see cases go down. We know that these tests can make a difference. Tests must be deployed. They can't be allowed to expire. And testing, like more contact tracing and vaccines, are going to be an essential part of the months forward as we get past this virus and this pandemic as quickly as possible. We all need to keep working together on all these different aspects to make sure we get through the summer in right form. En plus de parler de la nécessité d'utiliser les tests de dépistage lors de nos rencontres régulières avec les premiers ministres, on travaille maintenant avec le secteur privé pour déployer ces tests rapides dans les milieux de travail à l'échelle du pays. Le dépistage est efficace et on veut s'assurer que les tests de dépistage soient utilisés. Ces outils essentiels nous aideront à traverser les mois d'hiver et à amorcer la période de vaccination en masse au printemps dans le meilleur état possible. As Canadians, we all look forward to spring, this year more than ever. But I know we can all agree that there's one part of the season nobody likes: tax filing. Even so, it's important to file your taxes so you get things like the Canada Child Benefit, the Work From Home deduction, and the Climate Action Incentive. These benefits and credits can really help, especially after such a tough year. So that's what you should be able to focus on. Right now, I don't want you to have to worry about what you may owe in taxes. That's why we're providing 1 year without interest on certain 2020 tax debt, giving people more flexibility to repay amounts owing from last year. If you received federal emergency benefits, like the CERB, and you made up to $75,000 in taxable income, you will not have to pay interest on 2020 tax debt until April of next year. Our priority is ensuring that you and your family get through this pandemic and back on your feet. Cette dernière année a été assez difficile pour ceux qui ont perdu leur emploi ou ceux dont les heures ont été réduites. Que vous puissiez vous remettre sur pied sans que vous voyiez à vous soucier de l'impôt à payer. L'année dernière, plus de 8 millions de gens ont eu recours à la PCU pour payer leur loyer et mettre de la nourriture sur leur table. Je sais que certaines personnes ont souligné des renseignements imprécis concernant les exigences en matière de revenus nets et de revenus bruts pour qualifier pour la PCU. On veut clarifier la question. Les gens qui ont présenté une demande en fonction de leur revenu brut plutôt que de leur revenu net n'auront pas à retourner les paiements qui leur ont été versés tant que leur demande respecte également les autres critères d'admissibilité. For people who accessed CERB based on their gross income instead of their net income, as long as you meet the other eligibility criteria, you will not have to return those CERB payments. When we rolled out CERB last March, it was because people needed help in the face of a global, once-in-a-generation crisis. Well, the pandemic isn't yet over, so neither is our support. If you need help while you look for work, the Canada Recovery Benefit and Enhanced EI are there for you. If you need to take time off to care for your family, look to the Canada Recovery Caregiver Benefit. If you need to stay home from work because you're sick, the Canada Recovery Sickness Benefit is there to help. And if you need support on payroll for your employees or costs for your businesses, the wage subsidy and business loans are made for you. It's not easy to run a business from home or adapt to new public health rules. Yesterday, I spoke with Karen and Fahie. They're two young black entrepreneurs who have big plans. Karen showed me her photography studio and talked about the great work she's doing supporting black-owned businesses and products, and her excitement about moving forward to a bricks-and-mortar storefront as we move through this pandemic. But right now, she's all online. And Fahie talked to me about the costs of shipping coffee across the country and his excitement about building his business and also moving towards opening a coffee shop once we get through this pandemic as well. They all have big plans. And for all the young entrepreneurs across the country, all the entrepreneurs who are looking to go digital, to change their way of doing things, to grow through this pandemic and beyond, know that we are there to help you get through the hurdles and barriers in your way and create success, not just for you, but for employees, for community, and for our whole economy. We're here to support Canadian business owners, from training on e-commerce to targeted initiatives like the Black Entrepreneurship Program and the Women Entrepreneurship Strategy. Because no matter who you are, an entrepreneur, a worker, a parent, we've got your back. Cette pandémie n'est pas facile pour personne. En plus, l'hiver peut rendre tout ça encore plus difficile. Pendant le mois de février, parfois, on a l'impression que le printemps n'arrivera jamais. C'est normal si on ne se sent pas au sommet de notre forme. N'oubliez pas qu'il existe des ressources pour vous aider. Et d'ailleurs, ce jeudi, c'est la journée nationale du service 211, qui nous rappelle qu'on a tous accès à une ligne d'aide confidentielle et sans frais en composant le 211. Que vous ayez besoin d'un soutien en santé mentale ou de renseignements au sujet de services communautaires, n'hésitez pas à composer le numéro. Le service est offert 24 heures sur 24 dans 150 langues. Les agents à l'autre bout du fil vous aideront à trouver les bonnes ressources. Vous n'êtes pas seul. Alors s'il vous plaît, demandez de l'aide et prenez soin de vous. Before I close, I'd like to take a moment to recognize a great public servant, Ian Shugart, the clerk of the Privy Council. Ian has been an extraordinary leader through this public health crisis. He's leading the public service in tremendous efforts and supports to get Canadians through this pandemic. And as he faces health challenges, I want him to know that we're all pulling for him. Merci beaucoup tout le monde.
Of course, the CERB was put in place as a support mechanism for those who had lost their jobs or were laid off because of the pandemic and restrictions that were put in place because of it. Now that it's becoming tax time, there is word that there could be some repayment of the CERB back to the federal government. In which case, we just heard one explanation of how that the tax filings could affect how you were taxed on the CERB by the federal government. So we had to see how Justin Trudeau and his government actually proceed with those tax restrictions on the CERB and who has to pay most of it back. Okay, and next is we're going to hear from Prime Minister Doug Ford of Ontario with the stay-at-home order that was put in place there, and also finally we will hear from what is going on in Newfoundland, because there appeared to be a school outbreak that is affecting the whole area. Newfoundland Labrador is a series of small communities that they live what would be a remote life and keeping things simple. So an outbreak in that area could be rather devastating to the people there because of smaller populations. So let's listen to what both of those premiers actually had to say, what's going on in their area.
Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador COVID-19 update for today, Monday, February 8th, 2021. Health Minister Haggie and I are joining Dr. Fitzgerald today because we recognize that there are a lot of anxieties surrounding the recent cases of COVID-19 in Mount Pearl. Throughout this election campaign, and since becoming Premier, I've been very clear. The health and safety of Newfoundlanders and Labradorians is my priority. During this election, Dr. Haggie and I have continued daily calls with Dr. Fitzgerald and public health officials, even though we haven't been at these briefings. We have continued to focus on your well-being. As we said before the election started, we would be here if the situation warranted. Now I know elections are political by their very nature, but public health's evidence-based decision-making rooted in science is not. We've talked to representatives from the other political parties and the independent member in Mount Pearl. We are committed to making sure everyone is informed about what's going on. So please, please, get your information from trusted sources who are guiding us throughout this pandemic. Please do not politicize the health and well-being of the people of Mount Pearl. We are all better than that, and the people of the province deserve the best in us right now, perhaps more than ever before. We will get through this, Newfoundland and Labrador. Look after yourselves and each other, and I'll now turn it over to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have 11 new cases of COVID-19 in our province. All are in the Eastern Health region. We have 5 cases under the age of 20, 4 cases between the ages of 40 and 49, 1 case between the ages of 50 and 59, and 1 case over the age of 70. The total number of cases in our province is 427. There have been no new recoveries since yesterday, leaving 27 active cases in the province. And in total, we have tested 82,530 people. All individuals are isolating and contact tracing is underway. 3 of the cases are related to a previous case, and the remainder are under investigation, but it is still in the very early hours of the investigation. Therefore, we may still find that more of these cases are connected. Several of these individuals attended Mount Pearl Senior High, and the school has been notified, and public health officials are providing guidance regarding testing and self-isolation. If you are a parent of a student attending this school, you will be receiving information from public health and school officials on what actions you should take. We have a significant number of contacts associated with these cases through the school and various sports teams. Public health will be making contact with the teams impacted, as well as other close contacts, to provide guidance. Eastern Health is working diligently to conduct the contact tracing and notify contacts. I know this is a very stressful time for many individuals, and I ask for your patience as public health works through the significant volume of contacts. If you have been asked to get tested, please use our online assessment and referral tool to arrange for a test. The tool can be found at the top of our COVID website, and please only call 811 if you cannot access the tool. This assessment referral tool is the most efficient way to book an appointment for a test. If you have a family member in your home who must self-isolate, they must be separated from the rest of the family completely. They must have their own room with access to a bathroom that no one else uses, and they must not enter shared areas of the home. Meals must be delivered to them. If this is not possible within your home, and the person cannot isolate in another location, then the whole family will have to isolate together. Please take this into consideration when you're planning for your isolation. As a result of contact tracing as well as exposure notification for the Biggs restaurant in Mount Pearl, we have had over 2,000 individuals in Eastern Health Region come forward to request a COVID test. We expect many more as we work through the contact tracing process. As a comparison, we generally have less than 400 people tested in a 24-hour period. In response, Eastern Health has opened a temporary drive-through COVID-19 testing clinic at 50 Mundy Pond Road. The hours have also been extended for the drive-through clinics located at the Janeway and the Waterford Hospital. Please note that you must have an appointment to have a COVID test. At this time, we have 3 non-epidemiologically linked clusters, which are cases without an identified source. This signals to us that we have community spread in the metro area, the extent of which we do not know at this time. In response, I am announcing special measures orders that will implement restrictions in the St. John's metro area, taking effect immediately. Group and team sports and recreation activities where children and or adults gather in person and where close contact is required are suspended. This does not include individual activities such as walking tracks, gyms, or private lessons. Group arts and cultural activities that involve in-person gatherings are suspended. This includes bands, choirs, dance, and music classes. Solo performances and individual lessons are still permitted. Based on the epidemiology of our current cases, we know that these are the primary areas of risk right now. We will continue to evaluate the situation over the next 48 hours and will determine if additional restrictions are warranted. We know that residents of congregate living facilities for seniors are at the highest risk for severe effects of COVID-19. To that end, in an effort to protect the most vulnerable, today I'm announcing a special measures order that will reduce the risk of COVID transmission to long-term care homes, personal care homes, and assisted living facilities in the St. John's metro region. Visitation will be reduced to 2 designated visitors per resident. Group activities will be suspended, and activities outside of the homes will be suspended. Residents admitted from the community will require screening, testing, and isolation prior to admission. And staff will not be shared between homes except in urgent situations where direct resident care will be adversely affected. Thankfully, I am pleased to report that all residents of long-term care homes in St. John's who wish to receive the COVID-19 vaccine have received the first dose. Community spread is what we have tried to avoid for so long, but it does not have to be our fate. We have it in our power to bring this back under control, but we can only do so if we know about all of the cases of COVID in our province, and that is only possible if people come forward for testing. If you have symptoms of COVID-19, please use our online assessment referral tool to arrange for a test. A mild cough or a fever is enough to warrant a test, but you should also get tested if you have 2 or more of the following symptoms: headache, sore throat, painful swallowing, runny nose, diarrhea, loss of sense of smell or taste, unexplained loss of appetite, or small red or purple spots on the hands or feet. With community spread in our midst, we need to behave like we did in April by assuming COVID is in your community. We all need to follow the public health measures. Practice physical distancing between yourself and those who are not your close contacts. Wear a non-medical mask of at least 2 layers in indoor public spaces. Do not take the mask down to be heard or make a phone call. Wash your hands or use hand sanitizer upon entering and exiting establishments. Work from home if you can to minimize the number of contacts. Stay home if you are unwell, even if it is just a mild cough. If you're in the St. John's, Mount Pearl, and surrounding metro area, please reduce your contacts and avoid gatherings. Stick to individuals in your own household as much as possible. I cannot stress enough the importance of this measure. As a recap for those who may have just joined us, we have 11 new cases since yesterday's media advisory, and the total number of cases in the province is 427. This turn of events, while entirely unwelcome, is not unexpected. We have seen other jurisdictions in this same situation that have managed to reverse the trend. We have the control. We need everyone's help to turn this around. Thank you, and hold fast, Newfoundland and Labrador.
Well, thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for some comments.
Thank you very much, Premier. Well, we're in day 338 of the pandemic, and we have unfortunately achieved another milestone, that of obvious community spread related to this spike that we've seen over the last couple of days. I'd like to take this opportunity to thank Eastern Health for the speed with which they have ramped up. These things always seem to happen on a weekend, and yet always the regional health authorities step up and enact the planning that they have done so diligently in the background. I have been in discussions with the department and through them with Eastern Health. There are no issues around testing capacity. The public health lab can run 24/7, and there are adequate supplies of swabs and reagents and PPE in the supply chain. We have rapid test kits, should public health regard those as useful in this situation. But quite frankly, given the proximity of Mount Pearl and Metro in general to the location of the public health lab, there isn't an awful lot at the moment, I'm advised, to be gained by using such techniques. So again, thank you to those public health staff and emergency operations centre staff who gave up their weekends once again to make sure things were available to run swiftly. I think one of the challenges, and Dr. Fitzgerald and the Premier have alluded to it, is around information. We, as official organisations, are bound by certain legislation and certain regulations. We have to balance speed with accuracy, and we have to balance privacy with public health needs. And we have striven hard to do that. I think yesterday it was unfortunate that our media advisory was delayed, and I think that void generated more comment and more speculation than was necessary had we been a little quicker. And I will work hard with the staff in the department to ensure that every day at the appointed time some form of information goes out, even if, quite frankly, it is to say more to follow. I'd like to thank mainstream media. They have been extremely restrained and very responsible in waiting until official sources had provided them with information. And they have been really good about avoiding speculation in public. We've always known that a spike like this or community spread could happen. And indeed, some of the planners in the regional health authorities really had been waiting for this. So that, I think, has enabled us to be ready to ramp up to meet the circumstances. They were prepared to respond. We have a plan, and Dr. Fitzgerald has now outlined the public health responses that are appropriate for this level of concern and numbers. I spent time on the phone today with the Mayor of Mount Pearl, and they are obviously concerned. But his calm demeanour and determination to be guided by public health and best practices was very reassuring, and I think he again will become another trusted source of information for the citizens of Mount Pearl in general. That help and that calmness will help generate confidence, and we, for our part, will do our best to keep updating as and when information changes, and we are sure that it is accurate. Follow the recommendations and the guidelines. Follow the special measures orders. We've seen other jurisdictions in Atlantic Canada wrestle community spread to the ground by firm, decisive action in the early stages. And I think Dr. Fitzgerald and her team have provided us with those firm and decisive actions. I think the recommendations on a personal level that Dr. Fitzgerald read out are those almost identical to the ones that were read out over the last 10 months. And again, I would reiterate at this point, if you have any symptoms that fit into the category of COVID, you should use the online form as your first port of call to organize a test. We will identify cases in the community more by testing than we will by people sitting at home and hoping things will go away. And whatever the situation, whether your symptoms are sufficient or not, if you are not well, you should not go out of the house, period. So again, I would echo what Dr. Fitzgerald has said. We can get through this. Other provinces have done it. We have done it, and we'll do it again. So hold fast and hold the line. And with that comment, Premier, I'd pass it back to yourself. Thank you.
Well, thank you, Dr. Haggie. We'll now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you've noted now that there is community transmission and spread through the metro region. At what point will we be looking to revert back to alert level 3?
So right now what we're doing is, and we've said this from the start, we're trying to be as focused and as localized as we can in our responses so that we're not shutting everything down. So we're looking at where we're seeing this spread, where we're seeing these cases, and trying to make our measures in keeping with that. We're still very early days in this investigation, so if we start to see that there is if we can't link these chains of transmission together, if we're starting to see that there is more widespread community transmission, then we will have to consider more restrictive measures at that time so that we can reduce contacts and we can get this under control. We've seen that this works in other areas, in Brunswick, in Nova Scotia, so we don't have to reinvent the wheel here. We can certainly put things in place like they have done and see success, I think.
We know that Mount Pearl Senior High is the school that's currently affected by this, and there's no in-class has been suspended at this point. But we also know that students don't maintain a bubble of just Mount Pearl Senior High. Often they'll play sports with kids from other schools. How widespread are we anticipating this to be? Are other schools already being notified?
So at this point, as I said, it's still very early stages in the investigation. There were a lot of contacts that public health had to trace down. So I'm not on the ground doing those investigations. I don't have all of that information at this time. But certainly, if at any point we feel that another school has to be notified, that will happen. And I'm sure, then the public will be aware of it.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
With that uncertainty that there may be other schools affected, why not decide to close other schools until that contact tracing and that investigation can be done?
So at this point, we're basing our measures on the information that we have. Today's school snow day, of course, gave us a little bit of breathing room to be able to do some of that contact tracing. If we have to close other schools, we will. But I think we need to have the evidence to support doing that before we make a blanket statement.
And a question for Mr. Fury. There are some people who are now going to have to be in isolation and aren't going to be able to vote on Saturday. As the person who was responsible for making this election call, do you regret the timing of this election, and what would you say to people who, because of this, won't be able to vote?
Look, as I said when we called the election, this was a decision that I struggled with. I understand one thing we all understand with respect to the COVID-19 pandemic is the uncertainty. We made that decision at the time based on low numbers, and let's be clear, we still today have relatively low numbers. It's concerning, and I understand the anxieties today, but in a global sense, I have every faith in the public health officials that we can continue to navigate this, control it, contain it, and trace it. With respect to individuals who are isolating, Mr. Chalk, of course, runs elections. I don't run elections, and he has given us the assurance that a COVID scenario election was one that was doable. And when you look around the country at other jurisdictions that have held elections, full provincial elections, like Saskatchewan and British Columbia, and with a higher burden of COVID-19 than we currently have here today, it's doable. And I gather from some of the media statements that he's made that he's confident that it is. And following public health guidelines is paramount in order to ensure that we can continue to navigate this issue right now.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. The reference to musical performances, does that expand outside schools? Are we getting into the bar situation here? I know the Bigs is a restaurant or bar, but as far as public facilities and bars and restaurants and all that sort of thing, at what point does that become a concern, and does that include the musical performance?
So at this point, no. What we're talking about would be, group sessions where people are getting together. We're seeing some spread in younger people, and we're seeing lots of contacts in that group. So our concern here is really about trying to reduce those numbers of contacts and to reduce potential spread of any cases through those younger age groups. But we do have to be concerned about adults in that situation as well. So hence the reason why we have it for both children and adults. But at this point, we're not seeing spread in the bars. But as I said, if this is still early days, so if we start to see that there's increased community transmission, we may have to look at restrictions differently.
Thank you. And do you have a number now on the amount of people, the number of people? I know there was after the cluster a couple of weeks back, we talked about 160. Do we know how many people currently now are either self-isolating and or quarantined?
I don't have the precise number. It's hundreds.
So high hundreds?
High hundreds, yes.
So you wouldn't go as far as to say 1,000?
I don't know for sure.
Okay, thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, I was hoping you could clarify something you said earlier in your introduction. You mentioned 3 non-epidemiologically linked cases. And I'm curious, does that include the previously case that was under investigation a week and a half ago?
Yes, it does.
Perfect. And Minister, now that the government is in a caretaker role, are you still able to continue extending the Public Health Protection and Promotion Act?
I'm advised by Executive Council Act that the authority of the Minister to act in an emergency or in the public need exists, and I remain Minister until a replacement is sworn in. So the short answer is yes.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, Dr. Fitzgerald. How do you explain such a long window of possible exposure at the Bigs restaurant? We're talking about a 2-week period, and usually it's only a 2-day previous to symptom transmissibility.
Yeah, so in the Bigs, in that situation, because we had a case where we didn't have a source, what we were doing there was source tracing. We weren't actually... we did some tracing to look for, period of communicability as well, but it was really about trying to find a source for that case. So that's why we went back so far, because the incubation period is 2 weeks, right? So we had to go back about 2 weeks prior to the onset of symptoms.
Okay. And are you aware of any violations of pandemic orders that have been committed because of these cases, and I'm thinking particularly of the 20-person cap at events, informal events.
Sorry, the 20-person what, Peter? Sorry?
The 20-person cap on informal gatherings.
Oh, okay, sorry. So I'm not aware of there being any violations at this point. But as I said, it's still early days in the investigation.
Thank you.
Our next questions are from Jean-Philippe Hughes with Radio Canada. Please go ahead.
Hi, my question is for Andrew Furey. I'm just wondering, what are you anticipating as the impact on the election Saturday of these new cases announced today?
Well, we've said from day one that our team, and I've been assured by other parties that their teams as well have been following public health guidance and advice. We need to continue to do so diligently throughout the election campaign. We knew this was going to be a COVID-19 style election, so my party, for example, has pivoted, especially in the Mount Pearl area, to more of a virtual style campaign, and I think that's prudent and responsible. We all recognize that there had to be an election within the next 6 to 8 months. There's no way to fully predict the burden of COVID-19 and when things happen. I mean, we've seen that around the world. We have some of the best public health officials and public health advice here in Newfoundland and Labrador, and we've been following it. And it's one of the reasons why we're able to right now talk about numbers that are concerning, of course, and I would never say that they weren't, but really are the envy of other jurisdictions. I have every confidence in Dr. Fitzgerald and her team that they will get us through this in a safe, in a reasonable fashion. And I don't think that it will have, I hope, it won't have a great impact on the election on Saturday.
I have a follow-up for you, Mr. Furey. So we've just learned that hundreds of people are right now self-isolating or quarantined. But what are the options for them for voting on Saturday? Are they still admissible for some sort of online voting, or have they just lost their vote?
Yeah, Mr. Chalk is in charge of administrating of elections. I'm not, and I would never, ever interfere. So those questions are best directed towards Mr. Chalk. But as I gather from before, him and his team are fully prepared for COVID-style election, and presumably in his thinking moving forward about an election, because there had to be an election within the next 6 to 8 months. That's the law, so there had to be one. So I'm assuming Mr. Chalk and his team thought about different scenarios of COVID-19, including areas of clusters like we've experienced in the past. But again, I have confidence in Dr. Fitzgerald and her team that, as we've seen other clusters around the province, that following their guidance and their advice, we can tackle this one as well.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Given the growing situation, particularly in Mount Pearl, and when it comes to the senior high school there, is it still appropriate to have polling stations in schools this coming weekend?
Again, a question perhaps best directed towards Mr. Chalk and his team.
Sorry, I should have said that was for Dr. Fitzgerald.
Yeah, thanks. Okay, I thought it was towards me, Kellyanne, but I'm happy to turn it over to Dr. Fitzgerald.
Sorry, I should have pointed that, yes.
Okay. So, I mean, the school itself is not the issue. The building is not the issue. The issue here is contacts and people, how people interact with each other. That's how the virus spreads. So having the polling station in any building, as long as, public health measures are followed, and as long as people are careful and people physically distance and wear their masks, that risk is still the same as what it was last week. So we just, the building itself is not really, it's not really what the issue is when it comes to the spread of COVID-19.
Thank you. And when it comes to the current active cases, and I know test results that go to Winnipeg, any, I guess, sign of a variant here at this point?
So we've sent off a fair number of our positive tests for variants, specifically with this. With these cases now, we have sent off ones that we can to be tested for the variant. To date, we've been lucky in that we've not had any, but we do have to assume that any of these cases could be the variant. So, we are leading with that mindset, but so far we have not seen any cases.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question about testing. The minister mentioned that we have the testing capacity. I've heard from people who test, they've called to get a test and they're being booked for Thursday. So can you give me an idea of how long the wait is right now for testing, and how concerned are you about those times, considering the longer you wait to get a test back, the longer you then have to wait to do contact tracing, etc.?
I'll take this. Sorry, Janice, do you want to take a stab at this
No,
first?
I think you're best to take that,
I think
Minister.
it was directed at you, yeah.
Okay. No, some of the information that's provided on the form allows stratification of risk. So those people that Dr. Fitzgerald refers to as immediate contacts of a positive case, their tests are done with minimal delay. Those people who are contacts of contacts or who are part of this backward tracing exercise looking to find the source in Mr. Biggs, whilst useful and important, they are of a lesser priority because, as one of your colleagues pointed out, their exposure was well over 2 weeks ago. So we're actually testing for two reasons here. So a test that is scheduled down the road is scheduled down the road for a public health and clinical reason, not necessarily because of capacity.
Thank you, Minister.
And can you give us an idea then, what is the capacity? How many tests a day can we do, both from the lab capacity but also from the putting swabs in noses?
My understanding from the lab, running 24/7, is the figures are around 2,000, potentially 2,300 tests per 24-hour period.
And what about the actual swabbing?
That is not an issue because if more people are needed, people will be drafted from other areas. That's an operational question, more appropriately directed to the health authority, but they have not informed me of any constraints.
Okay, thanks.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Given the unknown, it's been mentioned a few times that we just don't know the extent of community spread here, and there are hundreds in quarantine, hundreds at least in self-isolation or quarantine. Are you just waiting for numbers to decide if an election is safe? I mean, the Premier said top safe, health and safety is the priority. We hear that a lot, but I mean, we have 11 new cases today, and there was an assumption on many that that would be more than enough to at least cancel or postpone the election, given the amount of people who can't vote because they're isolated, rotational workers are in isolation, can't vote, and so on.
So there was many different options to vote beforehand for rotational workers and others, and it's important to maintain anybody's franchise and ability to vote moving forward. But again, we've seen a higher burden of disease and higher levels of epidemiological spread in other jurisdictions around the country who have had elections, and I'm assuming, and again, it's best directed towards Mr. Chalk that him and his team have considered all these different scenarios going into a COVID-19 election. They informed us that they were ready for a COVID-19 election. We knew it wouldn't be a traditional election. We knew there would be different variables at play, and I'm assuming he's talked to other chief electoral officers around the country. But again, I wouldn't want to speak for him. I think that is best directed towards Mr. Chalk.
Thank you. And Premier, just a few moments ago, you also mentioned that candidates, at least for the Liberal Party, will be switching mostly to virtual in the Mount Pearl area. But given the community spread, I mean, Mount Pearl is not in a vacuum there. I mean, people are back and forth all over the metro region. Is it just limited to Mount Pearl that they're going to go virtual, or would it be safer for them to do it across the board?
I know we're monitoring that as data comes in, as cases come in, but from the beginning, we've been encouraging a virtual style campaign. So this won't be a difficult pivot for the candidates within the Liberal Party. We've been telling people to do as much as they can virtually. I know there was some door-to-door at times in particular districts, but you're certainly right. There's no wall between Mount Pearl and the surrounding areas, but that's why we're looking at these numbers as they come in closely, and we'll adjust immediately when appropriate.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. When you see this type of spike in cases with hundreds in self-isolation, what type of strain does this put on public health resources?
Certainly, it means there's a lot more contact tracing to be done, so that takes a lot more manpower to be able to do that. But our public health team in Eastern Health is quite good. This was the same team that dealt with the outbreak in the very early stages of the pandemic, when we knew not nearly as much about COVID-19 and how to control it as we do now. So, I think we are certainly watching that very carefully. We have options available. If we need more contact tracers, we can bring other people in. But at the moment, Eastern Health is faring okay.
Thank you.
And doing an incredible job.
Right on. And I'm curious, has there been any update on the presumptive case associated with the daycare in St. John's?
From 2 weeks ago?
Oh, yeah. So that's a long time ago. So that case was confirmed positive, but no implications for the daycare at that time.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Dr. Fitzgerald, we've asked you about election safety. I'm wondering, would you approve of candidates and volunteers driving voters to and from the polls on election day?
So at this point, we would not recommend that people would be driving in cars with people who are not in their bubbles. Not in their household, or somebody who, was in their extended bubble, we'll say. But so I think, people, it's unfortunate because I know that a lot of people do rely on the means of transportation to get you to the polls. But certainly, I think we'll have to reach out to people that you know and try to keep your contacts as small as possible.
Thank you. And Mr. Haggie, I know you've brought this up many times before. How do you feel about private citizens posting unverified information online before it's confirmed by health or education officials?
We have a freedom of expression here, Peter, and far be it from me to try and constrain it. I would have thought common sense would have suggested that we've had our share of fear-mongering. I mean, you remember we had that video of the Ladios at St. John's Airport making out no one was there to meet them on their flight, which turned out to be a total fabrication. And then we had panic in Bonavista, I think it was, when alleged plates appeared. So I think it's people's natural tendency to want to share and be sociable, but I think there is an element of responsibility here that has to occur. And as I say, our challenge is that as a government organization, or as an official response, we have to make sure that what we say is accurate. We have to make sure what we say is appropriate, and it needs to respect that balance between privacy and public health. It's a fine line, and people are often unhappy with the way we walk it.
Thank you.
Our next questions are from Jean-Philippe Hughes with Radio Canada. Please go ahead.
Hi, I'd like to have some precision about how do you define Metro St. John's area? Could you just let us know what's the zone exactly?
So we define Metro St. John's as, or the metro area, as being basically CBS, Conception Bay South, east, and then Witless Bay north. So basically the outside tip of the Avalon Peninsula.
Thank you.
Jean-Philippe, do you have a follow-up question?
No, I'm good. Thank you.
Thank you. I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
I do. In looking at how large that this contact tracing could be, and especially noting that Mount Pro Senior High has more than 900 staff and students there at one time, how long are you anticipating the school to be closed for?
At this point, we're still really early in the investigation, so it's difficult to say. It's going to be a couple of days for sure. We want to get people tested, so but exactly how long at this point, we can't say.
Thank you.
Peter Cowan with CBC, do you have a final question?
I do for the Premier. I'm wondering if you're able to give us an update on the status of Chromebook. Have they been deployed to students, for example, in the metro area, to allow a pivot to online learning?
Some have not. I've been talking with the Minister of Education, and we're changing the strategy to ensure that they're getting into the hands of the students who now need them the most. They were being deployed around rural Newfoundland and Labrador first, and based on a needs assessment prior to distribution. And so now we're deploying those in the metro region more quickly. I've been informed by the minister, and after discussions with the Eastern School District, that Mount Pearl Senior High will be ready to transition to level 3 for them, which would mean online learning in a matter of days. Again, this scenario, like the schools, like the election, like many of our businesses, has been thought about and planned for. And again, with leaning on Dr. Fitzgerald and her team, I think that we can get this up and running if needed very quickly.
Thank you.
Brian Callahan with VOCM, do you have a final question?
Yes. We've just learned, I guess, that there's another large group of people, namely seniors or people without transportation or even mobility issues. We know how elections work. You know, every party has drivers to get the vote out, and that happens a lot, and can be hundreds, thousands of people who may not be able to get there. Now, I know that you've been directing questions to Mr. Chalk as far as elections, but of course he's not a health professional, and at some point you must be consulting with him on these decisions around the election. So can you take us inside that discussion?
That's for Dr. Fitzgerald, is it, or for me?
Yes, please. Oh, I guess Dr. Fitzgerald, please. Sorry.
So our, with regard to the election, you know, public health is involved in a consultative role in that the elections officials develop a plan, and then members of the public health team will review that plan and consult on it to make some suggestions with regard to any improvements that they see that could happen or any gaps that they recognize, and then send that information back so that it can be acted upon. So that's the process that happens really in that consultative process. So yeah, so I don't know that we can say we've been in great discussions. It's really just been about making sure that we've been able to provide input to the plan that was developed, which is what public health has done with many organizations over the past year.
I'm sorry, and just to be clear, the final decision whether to postpone or cancel that election would lie with public health officials or Mr. Chalk?
Mr. Chalk.
Thank you.
Elizabeth Witten with All Newfoundland Labrador, do you have a final question?
Yes. I'm wondering if there's been any progress on getting whole genome sequencing in the province.
Yeah, so that's in progress. We are hoping that it will be up and running mid-February. So, you know, it's It's getting close. I don't have a definitive date, though.
Thank you. Peter Jackson with the Telegram. Do you have a final question?
Just one final question. You have an extra testing site set up on Monday Pond Road now. Are there any plans in the works to open other testing sites?
Certainly, the Eastern Health is looking at those options, and I think probably exploring those options as we speak, but I don't have any definitive answers as to where at this point, Peter. But we'll certainly be letting people know when we do.
Thank you.
Jean-Philippe Hughes with Radio Canada. Do you have a final question?
No, thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you for joining us today for the COVID-19 update. I want to stress to everyone to please be kind to each other. Because someone has a positive COVID-19 test doesn't mean that they need to be shunned or harassed. It's important that everyone feels safe to come forward to get tested for COVID-19. Dr. Fitzgerald and her team will ensure that that is the best thing we can do to contain and control this. I know there's a lot of anxieties out there. I feel it too. But please seek help if you need it. Look after each other and your neighbors where possible. And please stay safe in Newfoundland and Labrador.
Okay, lastly, we have Dr. Etienne of the Pan American Health Organization, or PAHO, making statements about how easy it could be for certain variants to be spread from one to another, and that we need to make sure we're taking extra precautions to make sure that we are doing the right things as far as self-distancing and wearing masks and things like that to protect ourselves from disease. So let's listen to what Dr. Etienne actually has to say. She is the director of PAHO.
The Americas. At least 19 countries in our region have reported at least one variant of concern, although PAHO is analyzing and updating this data continuously. Evidence is beginning to suggest that some of these variants, such as the ones first detected in Brazil and the United Kingdom, may be more easily passed on from one person to the next, therefore accelerating a rise in COVID cases. While we don't yet have the full picture, it is starting to become clearer. Each new variant of concern must be monitored closely to detect any changes in how it behaves and spreads, and to ensure adequate measures are in place to control it. There is no reason for alarm, but for attention. And I want to emphasize 3 important points. It is important that our response to the pandemic be guided by evidence and not speculation. Let me say that again. Our response to the pandemic must be guided by evidence and not speculation. And that's why PAHO works closely with some of the best scientists in the world, many of whom happen to be based in our region. They are outstanding research teams working on the ground in places like Manaus, Brazil, who are focusing on this issue and providing us with information as swiftly as they can. Responding to the variants of concern requires widespread collaboration, so new information is quickly identified and responses can be adapted as required. And that's why PAHO's surveillance network is keeping a close watch on today's variants of concern and working closely with similar efforts around the globe. PAHO's regional genomic surveillance network has increased our ability to sequence virus samples by 50% since the beginning of this year. At least 11 countries in our region can sequence virus samples and detect the presence of variants. We also count on our 2 reference laboratories based in Chile and Brazil, which are receiving viral samples from across our region and supporting a network of national laboratories. We must stay focused in improving our capacity for surveillance so we can keep track of trends, including the variants of concern. So far, the evidence on this virus does not change the fundamental aspects of our pandemic response. Our recommendations to prevent this virus remain the same. Uphold strong surveillance, limit gatherings, and practice social distancing, frequent hand hygiene, and mask wearing. All of these are still necessary, and they do work against COVID-19 in all its forms. By continuing to adopt these practices, even after we are vaccinated, we can not only limit the spread of today's variants, but prevent new ones from emerging tomorrow. Let me finish by reminding you that PAHO is a strong believer in the life-saving power of vaccines. Based on the evidence that we have now on the variants of concern, we are confident that our growing portfolio of COVID-19 vaccines remains useful and will guide us through the end of this pandemic. Our trust remains unabated. We have at our hands a whole generation of effective vaccines to prevent infection and especially severe disease. Down the line, we may need to adapt our strategies, but we will continue to rely on these vaccines. The challenge now remains to ensure that these vaccines are distributed quickly and fairly across our region, starting with those who need them most. Over.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we will be accepting questions, and let me remind you that you can send your question through the chat and Q&A buttons, and we also have simultaneous interpretation into Spanish, Portuguese, French, and English. We have received several questions in connection with the preparation of countries to start administering vaccines, and the questions are whether the question is whether the countries that have not started vaccination, what they can do, and what is the level of preparation for the arrival and deployment of the vaccines. Dr. Etienne.
So let me thank you for this question. PAHO has been supporting its member countries in their preparations to introduce the COVID-19 vaccines. And we have provided technical cooperation to help countries plan their vaccine deployment. We have distributed guidance documents, we have held training sessions, and we are giving the countries direct advice. We work with countries on their logistics to coordinate the delivery of doses and the monitoring of safety data, which is extremely important. We are also providing support with the recruiting and training of staff so that health personnel know how to deliver vaccines, and we advise them on public information campaigns to ensure that the people know where, when, and why to receive those vaccines. Let me inform you, thus far, some 31 countries of the Americas have provided information about their COVID-19 vaccine readiness through a tool that is called the Vaccine Introduction Readiness Tool, of VIRAC for short. And this is an online platform that is maintained by PAHO, WHO, UNICEF, and the World Bank. Of these countries, 21 have shared their national vaccination plan, and 20 have reviewed their cold chain equipment and procedures. The main challenges that were identified by countries relate to their information systems and not having sufficient trained staff. We have noted that 20 countries so far have evaluated their cold chain capacity to be able to handle these vaccines, as mainly those that require temperatures between 2 and 8 degrees centigrade. Now, this is really the same equipment that they regularly use in their immunization programs in maintaining the cold chain. I have made the statement, and I will say it again, our countries in the Americas have really very long, many years of experience in immunization, reaching coverages of over 90% of the target populations. And they have significant experience in doing immunization campaigns. So we are really helping them to boost that knowledge and that experience so they are ready to roll out vaccines immediately.
So, thank you for listening today. Of course, you're listening to Policy and Rights here on Depictions Media Radio, and I am your host, Michael Clogs. And one of the big purposes to actually doing this show, at least twice a week, is not only to inform, but to get people to think. We need to form our own opinions, and we need to question everything that officials are telling us. I'm not saying that we shouldn't obey it, we should be questioning it, because when we question these things, it helps people think. And when people think, we come up with bigger and better answers. Again, thank you for listening today, and we will see you next time. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.